affects 11 Americans out of every 1,000. And here to talk with us about this issue is Dr. Vijay. And good morning, Dr. Vijay.
Good morning.
How are you doing?
Very well. How are you?
Now, what is autism?
Okay. Autism is a specific developmental disorder that usually appears in children by about the age of 2, definitely by 3 years old, and the parents notice things, and it's a disorder in their ability to learn how to communicate, socially interact with others, and also children tend to develop some repetitive behaviors. Classic example is, for example, if you were to point at an object, instead of the autistic child looking at the object at which you're pointing, they look at the finger.
Okay.
And they're unable to grasp the fact that you're trying to communicate pointing at the object as opposed to the finger itself.
Just one of the warning signs there.
That's
you know,
right.
why is it so important to diagnose autism?
You know, the earlier you can diagnose, earlier you do diagnose autism, the more you can tailor behavioral therapies and various other therapy modalities that we have to the young child.
Okay.
And obviously the younger the child, the thought is the more able the child is to grasp what you're trying to teach them. And if you're able to teach them behavior modifications or other tasks that they can learn and then apply in their day-to-day events, and they can actually stay within the community, potentially within the family, and also be productive members of society, as opposed to what would happen, you know, 20, 30 years ago when most children with autism would become adults that really would become institutionalized for the most part.
Well, how young can you start seeing some of those symptoms?
In general, they're diagnosed by about the age of 2, but you can start seeing them as early as 18 months. You know, there's certain developmental milestones. For example, the child usually starts to babble by the age of 12 months, you know, starts to point at objects by the time of 18 months, has a couple of words and vocabulary by the time they're 2 years old. So, you know, if you notice that your child is lagging significantly behind their siblings or is just behaving very differently, it's important to bring this up to the attention of the pediatrician, who then can perform a battery of tests, and if they're concerned, then they can refer the child to a developmental psychologist or other physician or healthcare provider who then can definitively diagnose this problem.
Here's a question parents often wonder about. Now, are children who get vaccinated more prone to getting autism?
You know, absolutely not. Unfortunately, there was a paper that was published in one of the British journals of medicine many, many years ago, or several years ago, that drew a correlation between vaccination and autism. Since then, the data has actually been debunked. The journal has actually retracted that specific paper.
Really?
Yeah,
Wow.
but you know, the data is out there, and unfortunately there's still some people who espouse that theory, but there's no definitive science behind it.
Okay.
So it's very important not to withhold vaccinations from your children, because you know, then they might be at risk of developing certain other illnesses that could be much more detrimental to the child's health.
Very interesting. Thank you very much for joining us, Dr. Vijay. And remember, Dr. Vijay is here Sunday to answer all of your medical questions.